Hi, I'm Kirsten, the Ectopic Pregnancy Support Podcast host. Thank you for listening, and I hope these stories and conversations bring you comfort and help you feel less alone. Enjoy this episode. Hi, Kimberley. Thanks
Hi.
for joining me today.
How are you?
I'm doing well. How are you doing?
Not too bad.
Yeah.
Can't complain.
Yeah. Well, good. I think we should just get right into it. I'd love to hear your background prior to your ectopic.
Okay. So I live in Canada. I'm 38 years old. I have 3 children, all boys. I have a 14-year-old, I have a 12-year-old, and I have a 5-year-old. So
Aww.
things are a little bit busy, but
I'm sure they're very busy.
yeah.
What are their names?
Colin, Brendan, and Rain.
Oh, very cool. I like the name Colin. We almost named our rainbow baby Roy Colin because my husband's mom's maiden name is Collins.
Okay.
So we are kind of going to play it off that. So very cool. 3 boys. You're a boy mama.
I am.
That's awesome. Well, so when did your ectopic happen?
So my ectopic happened in March of this year.
Okay.
So I'll start off by saying that I have von Willebrand's disease, which is not very common. It's a hereditary bleeding disorder. So, and my ovulation has kind of been all over the place because I also have thyroid issues as well. So I had gotten my period on February 17th, and it lasts with the von Willebrand's disease. It lasts about 8 or 9 days.
Okay.
So I feel like sometimes I actually ovulate right after I come off of my period. So, had my period, sorry, came off of it. And, I found out actually in early March, I believe it was March 6th, I found out I was pregnant.
Okay.
And I thought that that was strange. For some reason, I was having no cramping, no nausea, but only one boob was sore.
Mm-hmm.
I was like, well, that's weird because I've been pregnant before, and usually both of your boobs are sore, and you're like, you know that you're pregnant. But I was just like, this is strange. Like I'm too early for my period, and only one boob's killing me. It's weird.
Yeah.
So I decided to take a pregnancy test, and it came up blazing positive.
Wow.
So that was I believe that was on a Saturday. So on a Monday, I called my doctor's office, and I had advised them that I took a pregnancy test and it was positive. And I'm 38, like I said, and I have 3 kids, and I had no interest in having any more children. So I feel like a lot of stories that I hear about ectopic pregnancies, people were trying to have a child, and for me, that just wasn't the case. Like if I hadn't had an ectopic, I would have asked for the abortion pill. Just being honest.
Mm-hmm.
So I ended up getting a call back on Thursday, and I believe I have some things written down just because dates are not good in my brain. So.
Yeah. Well, and there's so many dates involved with our ectopic stories.
Yes, and it's so traumatic that everything's kind of a blur unless you mark it down, right?
Mm-hmm.
So on March 13th, I got a call back from my doctor, and she said, yeah, I want to get your blood work done, and I can schedule you in for, to come in and we can look at getting the abortion pill and stuff. And I said, okay. And she said, before I want to do that, she said, I actually want to get you in for an ultrasound. And I said, okay. She said, typically we wouldn't be able to get you in for a normal ultrasound because, the timeline that you're working with that pill, you only have like a certain amount of time.
Right.
So where I live, there's actually something called the Rose Clinic, and they can get you in for an ultrasound relatively quick. So, and she also mentioned something about ectopic pregnancy. And then it just clicked in my head, and I was like, and I couldn't get ectopic pregnancy out of my head. Like something resonated with me when she said those words. Like I just had a gut instinct. So actually, that night on the 13th, that was a Thursday, I had gone down to Emerge because I started to get cramps.
Okay.
I hadn't had cramps up until this point, but I started to get them, and I was like, it could be implantation, it could be a miscarriage, I'm not sure what's going on.
Mm-hmm.
So I went to the emergency department, and I think I waited there for about 4 hours. And while I was in the waiting room, I started to get, I got, the cramps got worse. So I felt like there was a lot of pressure. So felt like I needed to use the bathroom. So I went to the bathroom, and I also have panic disorder. So I was having panic attacks pretty bad.
Oh,
So I started to have diarrhea.
okay.
I noticed after that, when I wiped, there was a lot of blood. And I was like, oh no, I'm having a miscarriage.
Oh.
But still, the ectopic thing was in the back of my head.
Mm-hmm.
So I went back into the waiting room after I went to the bathroom, and I started to feel this ripping, searing pain in my left side. So I think about 15 minutes after that, I was finally called back into a room. So I went into the room, and the nurse just literally led me into the room, didn't speak to me at all, and then went back into the pod. And I said, that's weird, because normally they would talk to you and write stuff down and then take it to the doctor or whatever. Nobody spoke to me.
Right. That's very strange.
Very. So I felt like I was in the room, and inside the room there's a sink, and then underneath the sink there's like cabinets that you can pull out, and there's a toilet. So more diarrhea, more bleeding. And then when I got off the toilet at that point, I was just like, I can't deal with this anymore. So I went out to the nursing pod, and I found my nurse, and I said, I'm leaving. I said, I think that I'm having a miscarriage. I just want to go home.
Mm-hmm.
So they gave me some of the big hospital pads.
Mm-hmm.
The ones that I had at home, were little thin overnight pads or whatever. I
Yeah.
just think that it would do the job.
Mm-hmm.
So I left.
They didn't do anything. They
Pardon?
didn't, even though you said you wanted to go, they didn't say, well, let me just
No.
check you out very quickly.
No, I said, I believe I'm having a miscarriage. I said, I've had a miscarriage before, which I did in 2015. So I said, I want to leave.
Mm-hmm.
And they said, okay. So they gave me the pads, and I went home. And then I went to sleep. And then I woke up the next morning, and I was supposed to drive my little guy to daycare. And I was feeling too sick. I couldn't. And my panic attacks were bad again. This whole thing has been nothing but panic attacks. So you're going to hear that a lot.
Oh, I'm sorry to hear that. That's really scary.
It is very scary. So I couldn't drive him to daycare. So I laid in bed for a few hours, and I was like, maybe I'll go to the Cobequid, which is a hospital further away. It's not like, I'm located in Halifax. I didn't go to the QE2 this time, which is where I went the night before. I went a little bit further out to go to the hospital again. So I sat in triage, or I sat in the waiting chair, and then I was called into triage. When I went in to talk to the triage nurse, I explained everything. And she said, it sounds like you're having a miscarriage. She said, I wouldn't worry about ectopic. She said, it's not something we hear about very often. So I said, okay. So they put a wristband on me, and I was supposed to stay there and wait for the doctor to be seen again. And then the panic attacks hit again.
Oh.
So I left again. And I went home. And at that point, I was still bleeding. Like, the bleeding had been off and on. So when I came home, I was still bleeding. And then I started to get pain up and around here.
Okay.
And I said, well, I just had a bladder infection a few months ago, and I bled with that. So maybe this is a bladder infection. So in Nova Scotia, there's an app called Maple, which is, you can go on and you can have a chat with an actual doctor, and they can prescribe you medication. They can fax the prescription off to your pharmacy.
Okay.
So I did that, and they prescribed me Macrobid. So that night I went and got it, and then I took my first pill. So when I woke up on Saturday, I was feeling a little bit better, but I had gone for my morning pee, and there was a clot about that big in the toilet.
Oh.
So I was like, oh God, okay, yeah, this was a miscarriage. I just passed the pregnancy.
Mm-hmm.
But I was very scared.
Mm-hmm.
So I called the paramedics.
Oh.
Paramedics came. They took my blood pressure, they took my vitals, all my temperature, all that stuff. And they said, everything looks good, but it was a female paramedic. And she said, It sounds like you had a miscarriage and you passed the pregnancy. Once again, somebody else telling me I wouldn't worry about ectopic, because that
Yeah.
was still in my head. I couldn't let it go. It was like,
Right. I wouldn't have been able to either,
yeah.
since that first person had said it to you.
Uh-huh.
Because it'd be hard. And then, of course, I'm sure you're doing all of this research,
Yeah.
and it
Oh,
continues.
Googling like crazy.
Yeah, I know.
Yeah.
I know. After you passed it, did you experience cramping still?
No.
Okay.
No, it was okay for the rest of Saturday. I felt okay for the rest of Saturday. I think I might have been cramping a little bit in the evening. I can't remember,
Mm-hmm.
but it wasn't anything significant. And then Sunday I woke up and I felt fine. I had no bleeding, no clots, no cramps, nothing. Fine. I remember actually getting up, having a shower, eating for the first time in 2 days, and putting on a pair of jeans and a hoodie. And I was like, okay, this feels good. I feel fine.
Mm-hmm.
So I guess it's gone. So going back to my ultrasound being booked, it had been booked for Monday, March 17th.
Okay.
So I got up March 17th. I took my kid to daycare. I was feeling fine. I remember being in the car and, music being on and singing. I was fine.
Mm-hmm.
So I got down to the VG and I'm bleeding again at this point in the morning. I felt fine, but I was bleeding.
Mm-hmm.
So I go in and I tell the ultrasound technician everything that's been going on. And at first they do an abdominal ultrasound on me, which didn't show very much because at that point I would have been, from March 17th, the start of my last period, to February 17th to March 17th, I would have been considered 4 weeks.
Yeah, right.
So they did that ultrasound and it didn't show anything. And then they did the transvaginal ultrasound.
Mm-hmm.
And she was there for about 10 minutes.
Wow.
And I finally said, what's wrong? What's going on? And she said, I'm going to go get the radiologist and I'll be right back. I said, okay. And my nerves, I'm like ready to run out at this point because I already know.
Right.
I had gotten I literally got my pants back on, my underwear, and I was just about to open the doorknob to leave. And the radiologist comes in and she says, Kimberly? I said, yeah. She said, I think that we're looking at an ectopic pregnancy right now. And my heart went through the roof. I thought I was going to throw up. I thought I was going to faint. It was just, you feel like something's going on, but then when you get confirmation, it's nerve wracking.
Yeah. Everything just seems to stop. Like the world just stops.
Yes, that's exactly how it felt. Because I didn't know what that meant for me, right? Like I'd never been through this before.
Right. I'm sure you were confused too.
Yeah.
From earlier, you had the bathroom experience. Mm-hmm. So in my mind, I probably would have thought like, well, what was that? What? There'd be so many questions.
Yeah. And I had told them, when she said, Kimberly, I think we're looking at it. And I said, no, we're not. I said, I just passed the clot on Saturday. I said, the pregnancy's gone. I said, I don't know what you're seeing. I said, and then the ultrasound technician was standing there. She said, it could be a loop of bowel. She said, but normally when a loop of bowel is going through, your muscle's contracting to push it through, right? Mm-hmm. She said, your muscle wasn't moving at all. So the radiologist said, I'm going to take a look. I said, okay. So the pants come off again, and she puts the transvaginal thing back in me. And she's looking around for 5 minutes, and I think it was like 5 minutes, and I finally said, I can't take this anymore. What is actually going on? Is it a loop of bowel? Is it an ectopic? What is going on? She said, it's an ectopic. And she said, I'm going to send you over to the HI. And I said, okay, back over to Emerge. She said, I'm going to call ahead and let them know that you're coming so you don't have to wait. So I'm ready to throw up at this point. I didn't throw up, but I was ready to. My nerves were shot. Yeah. So I end up back over at emergency, and I walk in, and there was a nurse there who immediately took me to the back, and he was just like, I remember actually, I forgot, before I left the ultrasound department, I asked her, I said, am I bleeding? Is there any internal bleeding? And she said no.
Okay, so it didn't rupture.
Right.
Okay.
So when I had gotten back over to Emerge, I was talking to, I think it was a nurse, and he said, what you have, he said, it's easily treatable. We can treat it with methotrexate. He said, it just goes up in your vagina. And I said, no, methotrexate doesn't go up in your vagina.
Right.
I don't
What?
know what he was thinking.
I've never heard that
Yeah,
ever.
right. That's what I thought. I thought, oh, okay, I never heard of this, but maybe is it like some sort of a suppository? I have no idea.
Right.
I think he was thinking about the abortion pill
Okay.
because the misoprostol or whatever it's called and all that, it's all methotrexate. So I think that's what he was thinking of.
Yeah. He must have gotten that confused.
Yes, yeah. So anyway, I went into a room. He led me into a room, and then another nurse comes in the room, and she said, she said, you're Kimberly Doubleday? And I said, yeah. And she said, okay, I'm going to get you a gown, and I'm going to start an IV. And I said, what do you need to start an IV for and give me a gown for? Oh, just in case you need to go in for surgery. And it's a good thing that I asked before I left the ultrasound department if I was rupturing, because if I didn't know that information and that they would have handed me that stuff, that the scrubs and the IV,
Yeah.
oh my God, I would have ran out because
that's so scary that they said that to you.
Yeah.
Even though you weren't at the stage of needing emergency surgery.
Right.
Oh, I'm sorry that you had to go through that.
Thank you. It's crazy.
Yeah.
So I told her.
The experience is already traumatic in itself, but that's just another. I mean, it seems like there were two instances where that guy gave you misinformation, and then the woman giving you the gown that just wasn't needed.
No, I don't think that I just think that they're so busy. You know, they work 12-hour shifts down here and they've got so many other things going on. I think that that's the last thing that they think about is trying to be, compassionate towards somebody that's going through a pregnancy loss, which is ridiculous. But
it is. Okay, so you kind of stopped her before she gave you the gown and IV and everything. Yeah. What happened next?
I said, I don't need that. I said, I was just talking to the when I just left the ultrasound department, they told me that I'm not rupturing. And she said, oh, okay. Like, how'd you not know that? They sent over paperwork saying, and I read my ultrasound report and it said there, like, there's no ruptures, there's no anything. So,
yeah.
So she left and I'm sitting in the room and I think I sat there for about a half an hour or so. And a woman from the IWK, which is a children's hospital, Women and Children's Hospital in Halifax, comes in and she says, hi, Kimberly. And I said, hi. She said, so you're going through a bit of an ectopic pregnancy right now. And I said, yeah. She was very nice. She said, you're a good candidate for method. I forgot that I did have blood work done at that point, though.
Okay.
So they did the blood work. Yeah. So anyway, she came in, she said, looks like you're having an ectopic pregnancy. And I said, yes. And she said, we did your blood work. And I said, yeah. She said, your levels were only at a 334. I said, well, that's good that they're low. She said, yes. She said, you're a very good candidate for methotrexate. And I said, okay. And I said, how does that work? She said, it's just a needle. It goes in your bum. She said, it's a cancer medication and it'll go in and basically dissolve the cells. And I said, okay. So after that, she put her fingers in and she felt around my abdomen and she said, nope, there's no blood in there. And I said, good. So, she said, I'm going to let you can go out and wait in the waiting room or whatever you want to do. She said, I'm going to call down to pharmacy and get the methotrexate. And I said, okay. So I go out in the waiting room and I'm sitting there and the person that I'm dating is a nurse and actually works upstairs. So I go up and see him for a little bit because it was his. So I go up and see him and I let him know, just give him an update of what's going on and stuff.
Was he in the know throughout this entire process?
Yes.
Yeah. Okay.
Yeah. He was working.
Okay.
So he couldn't be there with me. He was literally like 3 floors up from me though.
Oh.
Yeah. But so Anyway, I went up and seen him, and then I came back down. I'm waiting for another hour and a half. Pharmacy's slow. um, so then finally I get called back, and I go back, and she's got a big needle in her hand. And I said, "That's going in my butt?" And she said, "No." Or sorry, she said, "Yes." And I said, "No, it's not." She said, "What do you mean?" I said, "You're going to split that into two, and you can put them in my arms." So that's what we did.
Okay. How did you know
Then
that? How did you know that they could split it into two and it could go in your arms?
I think I was Googling it.
Okay.
Yeah, because I think I read that some other people had theirs put in their arms too.
Yeah, that's what happened to me.
Yeah?
They split the one into two.
Yeah.
And I do think they asked me if I wanted to do it in my hips or my arms, and I thought arms are more natural from vaccines, so I'll just do arms.
Yeah. And I knew that I would be laying down or sitting, and I didn't want to. I remember after I had Brendan, I had a UTI and I had to have an antibiotic shot in my butt. And I remember I couldn't sit for 2 days.
Oh.
Yeah. So I knew I was going to be sitting and I didn't want to be uncomfortable. So I told her to put it in the arms.
Mm-hmm.
So she did. And then I came home. And 3 days later, I went for, and I mean, panic attacks, crazy. I could barely sleep. I was shaking. I literally put myself on bed rest. Because I didn't want to move because I was scared I would rupture something. It was in my left side. I didn't want to sleep on my left side, even though the methotrexate gives you gas and you're supposed to sleep on your left side, apparently.
Oh, I didn't know that.
Yeah, apparently it's good for digestion and stomach stuff is to sleep on your left side.
Yeah, there are a lot of things that I found out after the fact that the medical professional did not tell me.
It's crazy.
Mm-hmm. It is.
Yeah. So 3 days of panic attacks, shaking, not being able to sleep, barely eating. I think about the third day when I got my blood drawn, I started eating. So I went up and had my blood drawn, and then it came back the next day that it was at a 121, which I was shocked.
Oh, wow.
I was completely, because they tell you that normally your levels go up a little bit after the shot and then they come down.
Yes.
But mine didn't. They went from 334 to 121.
Wow. Well, that's great.
Yeah.
It's weird to say that, but
it is.
It's good that it was working.
Yeah, for sure. So that was fine. And then I think it was that Saturday I was blonde, but I was getting sick of being blonde. Mm-hmm. So I dyed my hair like a purpley reddy color.
Okay.
So I was feeling a little bit better. And then on Monday, I had another blood draw. And then I think it was on Tuesday, the early pregnancy complication unit at the IWK called me back and said, your levels are at I think it was a 13.
Okay.
Yeah. And then
that went pretty fast.
Yeah. And then the following Monday or Tuesday, it was down to 0.
Okay.
Yeah. So it was over.
I say it went fast, but even though in the moment it feels like forever.
Yeah.
When you're doing the blood draws and
you're going through,
it really takes a toll on you. Mm-hmm.
Yeah. Yeah.
Yeah. Wow. That's wild. So once you reached 0, how did you feel after that?
Oh, really?
Yeah.
Brand new person, but still having a lot of and I'm still in therapy.
That's good.
It was just a traumatic, and I've never been so sick with worry and panic and anxiety in my life.
Mm-hmm.
So
I also never felt the amount of anxiety and depression I had since then. It was, I was so low.
Mm-hmm.
But I'm glad that you are in therapy and went to therapy because it truly does help.
It does. It does. And even doing this is therapeutic.
Mm-hmm. It is. That's what every woman tells me after they record the podcast after we'll chat for a little bit, and they're always like, this feels like therapy in the best way.
It does, and it helps that you're the type of person that you're mostly just quiet and you just listen and
Yeah.
you're understanding and you can relate because you've been through it. So
Right.
that
Yeah.
helps too.
Yeah, it really does.
Yeah.
Were you in therapy before?
Before this,
Yeah.
um, no, like off and on
Okay.
for a few years.
Okay.
Um, Mostly just because of my panic attacks.
Yeah.
I
That
think that
makes
was, yeah.
I was trying to find someone local to go to therapy with, and there were wait lists for months. And I thought, there's no way, I need help right now. So I ended up doing an online therapy, which ended up working just
Yeah.
fine. But um, when you need it, you need it.
Mm-hmm. Definitely.
Yeah. So how do you feel today about the entire experience? Can you believe that you had to go through all of that? And I don't know, I feel like the severity of the situation hit me later on.
Mm-hmm. Not for me. Um, I realized pretty quickly as soon as I found out it was ectopic that this could be a life-threatening situation.
Hmm.
Um, and that's why I wouldn't move off my bed for about 4 days.
Yeah,
I
that's smart.
The only thing I would do was use the bathroom, shower, and eat, and then right
Hmm.
back to bed. The only thing that would calm me down actually was watching, oh God, what's his name? Ennis, Enes, and then I can't remember his last name, but he does like host tours of big mansions, like in
Oh,
LA
cool.
stuff. And I was like, because I like looking at the inside of houses, I like interior design and stuff.
Uh-huh.
That's about the only thing that would settle me down was just
Oh,
laying for days and watching that.
yeah.
Yeah.
How was it with your boys? Did your
Um,
sons understand what were going on, or how did that work?
my oldest son understood. My youngest didn't get it.
Yeah.
Uh, he knew because I had told him, I said, Mommy's got a baby in her belly. Um, he knew that, but he didn't ask any questions. Still hasn't asked like, Mommy, is there still a baby in your belly? Like anything like that. Like I think he might have forgot. I'm not sure.
Yeah.
I'm not
Yeah.
sure. He hasn't mentioned it.
Oh, maybe he
Yeah.
just knew you were sick and something happened. Who knows?
Yes, exactly.
Hmm.
Yeah.
So what kind of advice would you give to someone going through an ectopic and are currently in the thick of all of the blood work and the unknowns, and what advice would you have for them?
First of all, I would say if you are not sure, always trust your gut. If you can't get something out of your head and something just keeps telling you over and over and over that something's not right, listen to your gut and advocate for yourself. Um, when you're going through the blood work, I'm not really not sure what I would say about that because mine went down pretty quick. I would say be patient. Take it as easy as you can. I hear people saying that they're getting up and they're doing their dishes and doing light housekeeping and all, and I wouldn't do any of that. Like I said, I stayed right here.
Hmm.
I didn't move. So if you can, and if you have somebody that your husband or a family member or somebody, if you have children, see if they can take them and look after them for a few days and really just lay down and take care of yourself and try not to move too much because it can be with today's medicine nowadays. I mean, they would catch it pretty quick, but you have to know what's going on in order to get yourself to the hospital or to call 911. Um, so it is a life-threatening thing. It's a very serious thing. I would say get some, get some counseling. I recommend therapy to everybody. Because
So do I.
yeah, totally. It's
Mhm.
important to talk.
Mhm.
Get therapy
Yeah.
and take it easy and be easy on yourself. And I think that's about it.
Yeah. That's great advice, and that's advice I probably needed to hear when I had mine, because um I worked up until the call from my doctor saying I needed methotrexate and I needed to go ASAP.
Right.
And that was a Tuesday afternoon, and I went right back to work on Wednesday and
Oh
would
no.
walk. And yeah, I just kept on moving, and I think that's my way of coping. But I look
Yeah,
back and I think I could have made it worse. Um,
definitely.
yeah, you just never know.
And I'm the same way when I get stressed out. I mean, I start cleaning and stuff, but if I'm going through something like that, I'm just going to listen to my body.
Hmm.
Yeah, that's listen to your body for sure.
Yeah. Well, is there anything else that you'd like to share?
I think I covered everything.
Yeah, you covered a lot.
I did.
You did.
I
Well,
appreciate you for